Alright, so the last part of the skeleton we want to talk about is the appendicular skeleton. We've talked about the axial skeleton. The axial skeleton is the skull, the vertebral column, and also the thoracic cage here. But now we want to attach things onto this axial skeleton. And when we attach something onto something larger, per se, we call that an appendage. So what are we going to attach onto this axial skeleton? We're going to attach the upper and lower limbs, and also the girdles that attach those limbs to the axial skeleton. So the appendicular skeleton consists of the bones of the upper limbs, the lower limbs, and also what we call these girdles that attach the limbs to the axial skeleton here. So if we look at the upper arm, or if we look at the arm, these are the bones of the arm, which are part of the appendicular skeleton. But we also have these girdles here, these two bones that are attaching this upper limb to the axial skeleton there. And what two bones are going to make up the pectoral girdle that attach the upper limb to the axial skeleton? We have the clavicle, and we also have the scapula. Then we get down here to the lower limbs. So here we have the bones of the lower limbs, but again, also part of this appendicular skeleton is this girdle that attaches the lower limb to the axial skeleton here. And these are called the hip bones, or the os coxa, and they are also part of the appendicular skeleton. Now the bones of the upper and lower limbs are designed really similarly. So basically they have the same fundamental plan. First of all, the bones of the upper and lower limbs are both composed of three major segments. So here we have the arm, we have the upper arm, the brachium, the lower arm, the antebrachium, and then we have a set of wrist bones, and then the hands. So this is our first segment, second segment, third segment. And the same applies to the lower limbs. We have an upper part of the leg, the femoral region. We have the lower part of the leg, and then we have a set of ankle bones and the feet. So again, the three same major segments. What these also have in common is that the number of bones in each segment and the types of joints that connect them are nearly identical between the two. So for instance, you have, how many bones do we have in the upper arm? We just have one. How many bones do we have in the upper leg? We just have one. What about the lower arm? How many bones do we have here? Two. How many bones do we have in the lower leg? Two. Okay. Then what? Well, we have a set of wrist bones. Over here we have a set of ankle bones. And then we have the fingers, or the phalanges, and then in the foot we have the toes, or the phalanges. And so the number of bones between each of these segments is nearly identical as well. And also, lastly, the types of joints that connect these bones are also identical. So we'll look at this later, but here we have the head of the humerus fitting into the scapula. And this is a type of joint called a ball and socket joint. If you look over here at the hip, here you have the head of the femur sitting in the hip bone, and this is also a ball and socket joint. Then you get down to the elbow, and that's a hinge joint there. Guess what type of joint you find at the knee? a hinge joint. Then we got down here at the wrist bones, which are the same type of joints as the ankle bones, and then the same applies to the phalanges as well. And so the fundamental plan, the design plan between the two, is nearly identical. Okay, let's take a look at the pectoral girdles. Again, these are part of the appendicular skeleton. This is the axial skeleton here, and we have the bones of the pectoral girdle that attach the upper limb to the axial skeleton here. So what bones does this consist of? We have the clavicle anteriorly, and then we have the scapula posteriorly. And when you take this pectoral girdle and you put muscles over it and all that kind of stuff, then that collectively forms the shoulders. Let's take a look at some of these bones here. So first of all, we have the clavicles. We have the clavicles, also called the collarbones. These are slender, S-shaped bones, and you can palpate this if you start medially. You can identify it would be this end right here, the sternal end of the clavicle, and you can palpate it all the entire length. Okay. And one of the things that it does is it holds the shoulder and arms out away from the thorax. So basically, it takes the shoulder here, and instead of the shoulder being up against the thoracic cage, what it does is it braces it and it moves it out laterally and takes it away from the thoracic cage. And that just gives it better functionality. Okay, we have better movement out there. And this becomes apparent if you have a break in the clavicle, a complete break, because what happens is the shoulder completely collapses on the thoracic cavity there, on the thoracic cage. Okay, so here we have the clavicle here, and laterally the clavicle articulates with the bone marking of the scapula called the acromion process. So the clavicle forms a joint with the acromion process there, and that forms the acromioclavicular joint. So that's kind of a joint within the pectoral girdle that holds the pectoral girdle together. But then if you follow the clavicle medially, okay, it forms a joint with the sternum, and in particular this upper part of the sternum that we call the manubrium. And this is called the sternoclavicular joint. Sternoclavicular joint. And as we'll find out, this is the only bony attachment, the only bony joint that attaches the pectoral girdle and the upper limb to the axial skeleton here. Alright, so now we have the scapula, or the scapulae is plural, and these are also called the shoulder blades. They're thin, triangular, flat bones. You can see how thin they are there. And they lie on the posterior surface of the rib cage, pretty much between ribs 2 and 7 is where the scapula lies on top. And there's skeletal muscles in between those. Okay, and so the scapula is not forming a joint with these bones here. There's actually skeletal muscles underneath there. Okay, here are some parts of the scapula you're going to have to know. So first of all, you want to kind of get an orientation of how the scapula sits on the back of the rib cage. And see, this is an anterior view here. Okay, this is a posterior view. We'll take a look at that first. So that's a posterior view, and you have this border right there is called the medial border. Where's that up here? That's the medial border right there. Why is it called medial border? Because it's medial. So that's a handy landmark to know. That's the medial border. It faces medially. You also have the spine. of the scapula. There's the spine of the scapula there. Okay. We have the acromion process there. You can see the acromion process forming a joint with the clavicle. We have the coracoid process. We'll talk about that in a little bit. This is an anterior view, and what happens is one of the bicep muscles right there has a tendon that comes up and attaches to the coracoid process. But then another important bone marking that you guys have to know is the glenoid cavity. What happens at the glenoid cavity? Why do we have this depression there? Well, that's where the head of the humerus is going to sit in. So this is where the shoulder joint is actually formed between the head of the humerus and the glenoid cavity. This is what I was just mentioning before with regards to the acromioclavicular joint, or the acromion process, I should say. This is the acromion right there, and you can see that the clavicle comes along here, forms a joint, forms the acromioclavicular joint, and then that other bone marking, so that's the acromion process in back, and this one in front is called the coracoid process. And again, like I mentioned, here's a bicep muscle, and the reason it's there is because you have a tendon for the bicep that comes up and attaches to that coracoid process. Now the scapula are interesting because they're essentially resting on the back. Okay, there's, like I mentioned earlier, there's skeletal muscles that separate the ribs from the scapula there. So why is that important? Well, it doesn't form any bony attachments, and so what that allows is it allows the scapula to slide freely across the back. Okay, it can move down, up, medially, laterally, all sorts of stuff. Again, because there's just skeletal muscle up there, and the scapula is able to slide freely across this. So why is that important? Well, it allows a wide range of movement here. Okay, you can move the scapula in all sorts of different directions, and it allows for a lot of complex movements in a wide range of motion. Okay. All right, and then there is the glenoid cavity in the scapula. Here's the head of the humerus. That forms what's called the glenohumeral joint, or the shoulder joint there, but glenohumeral joint is good. Now, one thing about this glenoid cavity is that it's pretty shallow. Okay, it doesn't have a big indentation like that. It's just shallow there. Okay, and there's positives and benefits to that. What's a positive to having a real shallow joint here? Well, it allows the head of the humerus to move pretty freely in there. This is a ball and socket joint, and because this is so shallow, that it allows a wide range of movement. Okay, it's not going to restrict movement. It doesn't restrict movement of the humerus. So this is good for functionality and for range of motion, but it's bad because this humerus, because it's not reinforced that well, it can pop right out, and it can cause a dislocated shoulder there. Okay, now we get down to the humerus. So this is the sole bone of the brachial region. Here's the head of the humerus right here. Then we get down at the distal end of it, and we have some bone markings. This is an anterior view, first of all, and this is also an anterior view, and this is the right limb, and we have this bone marking there called the medial epicondyle, and you can palpate that, you can feel it, okay, and it's right there. And that's actually what we refer to as our funny bone. Okay, what happens if you hit that, it actually impinges on the ulnar nerve, and it causes a radiating sensation down the arm, but you're actually hitting the medial epicondyle. Another bone marking we need to know is the trochlea. That's the trochlea right there. And the trochlea is going to be important because that's going to help form the elbow joint. All right, then we get down to the forearm, or the antebrachial region, and there's two bones. that make up the antebrachial region. And again, this is right, it's an anterior view. And the reason this is important is because you need to know which one is medial, which one is lateral. Okay, when we're looking at the ulna there, is that medial or lateral? That's medial. And then you have the ulna over here, and that's lateral. Some other bone markings you guys are going to be responsible for. This is the proximal end up here. The olecranon and the trochlear notch. We'll take a closer look at those in a second. And then here we have the radius, and that's the head of the radius there. Okay, so now we're down to forming the elbow joint. And the elbow joint is formed from the distal end of the humerus, and the forearm bone that actually forms the proper elbow joint is the ulna. Okay, the radius is going to form a joint with it, but it's not what we call the elbow joint that's associated with elbow movements and whatnot. So the bone markings that are going to form the elbow joint on the humerus, we have the trochlea. And where's that going to fit in the ulna down here? It's going to fit in this notch right there called the trochlear notch. So that fits right in there, and it forms what we call a hinge joint. Okay, and that hinge joint is going to allow for a restricted range of motion, or for certain ranges of motion. And then this is a posterior view here, and a bone marking I want you to know on the posterior side is the olecranon, and this is also on the ulna. And this is essentially your the point of your elbow. Okay, so you can palpate that as well. If you're interested in this kind of stuff, physical therapy kind of thing, then there are some other bone markings, some other joints down here that you may be interested in, but this is not going to be on the exam, which is why I have this smiley face here. This is also extra information, but again, this is relevant information if this is what you're going to go into. These are the this is the joint that's formed between the radius and the ulna. And this allows for supination and pronation, and we can go over those movements if you're interested in those. Okay, so here's the radius, there's the ulna, and now we get down to the hand. And the hand, the skeleton of the hand, includes a set of carpals or a set of wrist bones. And so those are the carpals or the wrist bones. And then we have the metacarpals, or the bones of the hand. Those are the metacarpals there. And then we have the bones of the fingers, or the phalanges. So if I were to draw those in different colors there, here's the carpals, or the wrist bones. Here's the metacarpals, or the bones of the hand. And then here are the phalanges, or the bones of the fingers. Let me see if yeah. Okay, so here are all the carpals right there, and the wrist, or the carpals, consists of 8 approximately marble-sized bones, and these are short bones that we call the carpals. And they're arranged in basically 2 kind of irregular rows here. But and they all have specific names, but for the exam you guys can just recognize these as the carpals. And what happens essentially, the major joint that forms the wrist joint that allows for flexion and extension of the wrist is the radius here. So the radius comes in and forms a joint with these carpals. And these carpals are synovial joints, and what type of movement do they allow for? So they have these flat surfaces against each other, and they allow for gliding. Okay, so you can perform those motions there because those carpals are moving across each other. Let's see, this is a inferior view here, and these are the wrist bones right here. And what this is showing is that the wrist bones have this empty space that essentially forms a tunnel, and this is called the carpal tunnel. Carpal tunnel because it's a tunnel that's formed by the wrist bones. And you can see you have a bunch of tendons coming through here. You have nerves. You have arteries. And so if you get a little bit of impingement there, then you can impinge on those nerves and cause some uncomfortable sensations in the areas of the hand that nerve serves. Okay, and now onto the metacarpals. The metacarpals form the palm of the hand, and these are long bones. They're short, but they're considered long bones. And these aren't named, but they're numbered. Okay, they're numbered 1 through 5 using Roman numerals. And so this is a posterior view of the hand. And is this the right hand or the left hand? This is the right hand. How do you know that? That's the thumb right there. Okay, so the metacarpals are numbered 1 through 5, and the first metacarpal is the metacarpal that's associated with the thumb there. So that's 1, 2, 3, 4, 5. And for the lab exam, you guys will have to number these metacarpals 1 through 5. Then we get to the fingers, and the bones of the fingers are called the phalanges. And there's one exception here, but the phalanges are each composed of 3 bones. You have a proximal phalange, you have a middle phalange, and you have a distal phalange. So all of these fingers here are actually composed of 3 bones, and there are joints in between each of these, and so there's movement that's allowed at each of these. So here you have your finger, and here are those 3 bones, and like it shows, you can have movement at each of those joints there. The only finger that does not have 3 bones is, guess what? The thumb, and that has a proximal and a distal phalange, no middle phalange. Alright, and now we get down to the lower limbs. And the girdle that's going to attach the lower limbs to the axial skeleton is the pelvic girdle. And the pelvic girdle is formed by a pair of hip bones. So there you have a pair of hip bones. And again, the hip bones are going to attach the lower limbs to the axial skeleton. So where is it that the hip bones attach to the axial skeleton? It's right here at the sacrum. Remember, the sacrum is part of the axial skeleton. It's the bottom of the vertebral column. And there's a joint that's formed here called the sacroiliac joint. Okay. Now you'll notice here that the hip bones are in 3 colors, and that's because during childhood, the hip bone is actually 3 separate bones, and then they fuse together in adults. But the hip bone retains these individual names just so we know what part of the hip bone we're referring to. And specifically, we have this upper region that includes the iliac crest here, and kind of this whole fossa or depression in there, and that's called the ilium. Then we have this region that moves anteriorly, and you can see this is where the 2 hip bones attach to each other. This is called the pubis region. And then we have this area in back and that's called the ischium. There is some dimorphism in the pelvises between the male and female. Okay, one of these is male, one of these is female. Which one is which? So I want to point this out. This is a posterior view here, and the sacrum is essentially right there. And so this is the sacroiliac joint. And what I want to point out here is all these ligaments. Okay, the back of the hip is strongly reinforced with all these ligaments here. And so there's not a lot of range of motion. So what these ligaments are doing is they're essentially securing the sacroiliac joint there. Okay, there's a lot of reinforcement there. So that's not a joint that we want to move around. Okay, here's some bone markings that we have to know on the hip joint. Here's the iliac crest, and you can palpate that. There's the sacroiliac joint. That's an important one. This is the pubic symphysis. The pubic symphysis is the joint that connects the two hip bones together. Okay, the two pubis parts of the hip bones. And then we have this depression here, and it's a deeper depression than in the shoulder, and that's called the acetabulum. Okay, and then on to the hip joint. So basically the hip joint is formed like the shoulder joint. You have the head of this bone, except this is the head of the femur, that sits in a depression. And that depression is the acetabulum. And collectively, that forms the hip joint, or the coxal joint. And again, this is a ball and socket joint, just like the shoulder. There's some differences, though. Okay, the shoulder had a really shallow socket. Okay, but instead, now the acetabulum, we have a much deeper socket. And so what that allows, it allows the head of the femur to sit in there a lot deeper. And what does that provide? Well, it provides more stability. Okay, it's a lot more difficult to dislocate your hip joint than it is your shoulder joint. But the downside is it allows for less mobility. Okay, you still have a lot of mobility. It still is a ball and socket joint, but it's less so than the shoulder joint. All right, here's the femur here. And something that's interesting is it does course medially a little bit as it goes down towards the thighs, or it goes down the thigh. It's the single bone of the femoral region. It's the largest, longest, strongest bone in the body. And here's some bone markings that you guys have to know on the femur. This here we have the greater trochanter. You can palpate that. Here's the neck. Well, let's just start proximal. Here's the head of the femur. There's the neck of the femur. And actually, the neck here is the weakest part. And so when people get a broken hip, a lot of the times what's going on is it's a fracture in that neck region. Okay, then we move distally, and we have what we call these condyles, the medial and the lateral condyles. Just the lateral condyle, medial condyle, lateral condyle, and those are going to be involved in forming the knee joints. Okay, then we move on to the crural region of the leg. And here we have two bones, two parallel bones. And these are the tibia and the fibula. Here we have the tibia, and here we have the fibula. Again, which one's medial and which one's lateral? You can orient yourself there. And as it turns out, the tibia is going to be medial and the fibula is going to be lateral. And the tibia is also a large bone. It's the second largest bone in the body. Okay, some more good stuff here. Here's that medial epicondyle. There's the lateral epicondyle. And we have this bump on the front of the tibia called the tibial tuberosity. You can palpate that. You have this surface or this border on the tibia called the anterior border, and there's no skeletal muscles that go over that, so you can palpate that. That's essentially your shin. And then we get down distally, and we have the medial malleolus. And the medial malleolus, this is basically the medial bulge of the ankle, and you can palpate that. Then we also have what's called the lateral malleolus. This is part of the fibula, and that forms the lateral ankle bulge. Okay, now we get down to the knee joint. And the knee joint, it's a hinge joint here, and the bone markings that form that on the femur are the medial condyle. This is the medial condyle, and the lateral condyle of the femurs, and that forms a joint with the medial condyle of the tibia and the lateral condyle of the tibia. And so together, this forms the knee joint and allows for movement at the knee. This is just more information that if you're interested in it, you can check out. Okay, and then we get down to the skeleton of the foot, and just like the hand, there's a set of short bones here. These are the ankle bones. Okay, so you have the ankle bones, then you have the bones of the foot, or the metatarsals, then you have the bones of the toes, which are the phalanges. And again, all of these tarsals have individual names, but there's two, well, you have to know them collectively as the tarsals, but there's two specifically you have to know. The calcaneus, okay, that bears the weight of the body there, and then we also have the talus up here. And the talus is important. You can see that little faucet there. The talus is important because that's what's going to actually form the ankle joint. And this just shows those individual bones there. Here we have the talus, though. And again, this is what forms the ankle joint. Here we have the tibia, and there we have the fibula. And they're both forming joints there on the talus. Okay, then we get down to the oh wait, not there yet. We're still on the metatarsals. And again, the metatarsals are numbered 1 through 5. Guess where number 1 is? Number 1 is associated with the big toe. Okay, so there's metatarsal 1, 2, 3, 4, 5. And then with respect to the phalanges, each of these toes is made up of 3 phalanges. 1, 2, 3, 1, 2, 3, all the way over, except we have one exception. What's the exception? The exception is the big toe, or the great toe, or the hallux, and this has a proximal and distal phalange only. Okay, and then if you look at the bottom of the foot, you have this fascia, this band of tissue, that ligament that basically connects from your calcaneus to your toes here, and that's called the plantar fascia. And I bring that up because that's important. Well, one, it supports the arc of your foot, but people also experience inflammation there, plantar fasciitis, which can be quite painful. Okay, that's good.